chapter, we will discuss an important topic about the color uh, perception and how to get the most aesthetic results by choosing the appropriate color that matches the teeth. First, there is three main properties for the color. The first one is the hue, which is the variety of a color, which means this color is reddish or greenish, yellowish, and it is determined by the wavelength of the reflected or transmitted light observed. Chroma is the percentage saturation of the color, which reflects the concentration of the pigment. The value is the lightness of the color, which means that is it goes near to reach the white color, or on the darkness side where it goes to the black color. It is a direct consequence of the amount of light energy the object reflects or transmits. Note that when we have a restoration that has too high a value, which means it reflects so much light and has poor translucency, it is more easily detected that it is fake and not realistic enough. And this is so common in the metal ceramic prosthodontics, where the metal makes it so difficult to get the aesthetic results that we need. We usually say that when you want to take the color of the teeth, take it on the daylight. Although initially this is a good idea, but it is not recommended. The reason is because the color of the daylight varies from red-orange at sunset to blue when the sky is clear. Also, it is affected by the cloud cover. So, using a light source that is comfortable to the eyes and it is a stable, constant, which has relatively equal quantities of electromagnetic energy is the best type of light to be used when we want to take the color. So pure white light is the recommended color when we want to take the color of the teeth. The opulences terminology, it is a quantity that is found in natural teeth, especially in the incisal edge, where we exhibit a light scattering effect that creates the appearance of a bluish-white color. It is also seen in gemstones, so this term is now used to indicate the manufacturer effort to get products that can reach to this high aesthetic and aesthetic results. Color blindness is a defect in the color vision. It is found in male more than female. It has the three types. The first one, where we have a complete lack of hue sensitivity. The other type is when there is a lack in specific type of colors, for example, the red or the green. The third one, that the patient is sensitive to all three hues, but there is some lack of primary pigments in the retinal cones. So the dentist should have their color perception tested. If any deficiency is detected, the dentist should seek assistance when selecting the tooth shades. Let's discuss the concept behind the 3D Master Vita color guide and how it is designed and how we can use it to get the color. It is divided into 5 groups. These groups represent, which is the lightness of the color. It increases from 0 to 5. This is the first thing that we choose. There is a middle center sample tooth, which is located in the center of each group, and above it are 3 shades, and under it is another 3 shades. Its name is M2, and the benefit of it is the primary selection of the value. We look to this middle value and we choose the group. Value is represented by the number that is beside the letter. This is it. The second thing, we choose the chroma. Chroma, as we said, is the percentage of the saturation of the color, which increases from up to down. And it is the number under the letter. This is it. The last thing is the hue. We choose whether it is a reddish or a yellowish color, which means that we choose whether it is L, yellow, which is whether it is M, middle hue, or whether it is red or red. So the when we say 2M1, the 2 is the value, the M is the hue, the 1 is the chroma, which the chroma represents how pale or saturated, the value, which represents how light or dark this color is, and the hue, how yellowish or reddish the color is. In some cases, if we did not get the tooth shape that resembles the patient's teeth, we can use a custom stained that has inside the kit, which have 14 or 6 stains, and we can try several times until we match the adjacent teeth. Then we send it to the dental laboratory to get the identical color that we want. There is a company in Switzerland that can do custom-made tooth guide, and this is the link of their site. Even though some error happens and the laboratory in some cases is not able to get the shade that we chose. The reason for this is when we have a metal ceramic restorations, the underlying metal used can affect the porcelain color, or the brand of the porcelain may vary from brand to other. The number of times of the glazing that was performed also affect the result. There is a device that is called the Replicker Quick Shade that can automatically choose the shade of the teeth. At the end of the chapter, they are discussing the concept of smile, digital smile design, and they are showing this case where the patient has a gummy smile and a high smile line. And photographs were taken. A full 3D scan was made for her head, and an intraocular scan was made for her teeth. Then it was the digital smile design was made using the software. After we got the optimum results, the 3D printed cast was made and a trial restoration was tried in her mouth, and we can see the big difference between the two. This happened due to the aid of the technological advances. That's it. Salam.